Hello everyone, welcome to the program produced by Shandong Education Satellite TV on epidemics control and prevention. I'm Zhang. Because of a density of personnel, school cafeteria is the key area of epidemic prevention and control. Before school reopens, 14 days of self-quarantine is required for all cafeteria staff. If showing no symptoms, then they can go back to work and carry out disinfection and personal protection training to ensure that staff understand how the virus spread and disinfection methods. After school reopens, the personnel should take and records body temperature before going into work area every day. Personnel should do hands disinfection before entering the work area. They need to wear a new mask and protective clothes before entering the work area. We have invited the director of Shandong CDC Food and Nutrition Institute, Dr. Liu, to share more with us. The video we just watched mentioned management of epidemic prevention and control for staff members. Since the food for teachers and students all come from them, the strict management of cafeteria staff is very important. Indeed, it is an important part of epidemic prevention and control, which directly affects the health of all teachers and students. In addition to personnel, facilities and equipment in the cafeteria should also be taken care of carefully. After such a long holiday, all equipment needs to be cleaned, disinfected, maintained, repaired if necessary. Therefore, below measures will be needed to guide the implementation of these matters. Staff should wear masks at all times, wash hands, and do hands disinfection regularly. Check inventory of food and raw materials. Get rid of expired food in accordance with related regulations. Check and maintain refrigerators and water supply equipment to ensure water usage. Clean and disinfect cafeteria floor at least once a day. Open windows for ventilation at least 2 times a day, no less than 30 minutes each time. Use ultraviolet lamp for disinfection regularly and adjust in disinfection times according to actual needs. Ensure strict management of facilities and equipment. Regularly maintenance of food preservation and cleaning and disinfection equipment. Clean and disinfect air filter regularly. There are some other areas need to be disinfected regularly. They are locker room floor, wardrobe, doorknob, refrigerator and its doorknob, equipment in food preparation room and its floor, the surface of all the desks, cafeteria door, floor and doorknobs, computer mouse, keyboard and phones, and all the trash cans. The disinfection of the cafeteria must be meticulous in order to ensure that the breeding of pathogenic bacteria is reduced, and also reduce cross-infection between the tools, containers, and food. In addition to the management of personnel, equipment, and facilities, the next step is the management of food purchasing. Record the source and channel of food and all raw materials, and keep relevant purchasing documents and receipts. Do not purchase any meat from unknown sources without quarantine. Strengthen the management of vehicles used for food purchasing and distribution. Vehicles should be cleaned and disinfected before each transportation. During the epidemic prevention time, try not to provide such as raw food, juice, bread, and cakes. Food processing should be carried out strictly in accordance with the following safety regulations for catering services. Why can't we provide raw food, juice, bread, and cakes during the outbreak? These foods are prone to produce pathogenic microorganisms because of improper preparation or storage. During the epidemic prevention time, people doesn't do much exercises and they weakened their immune system. Eating such foods is more likely to cause stomachaches. Next, we will need to pay attention to the ways of people having meals in cafeteria. Schools should note that during the epidemic prevention time, we should set up separate entrance and exit. Set up a quick meal access channel. Set up a temperature checkpoint at the entrance of the cafeteria and provide hand sanitizer. All teachers and students need to wear masks when entering the cafeteria. Schools with accommodation should pay attention to the ways of taking meals. A representative can be assigned to take meals for the residents, and they should leave immediately after taking the meals. Other schools should set different times for meals to avoid congestion. Before entering the cafeteria, students should check their temperature at the entrance, disinfect the soles of their shoes, wash their hands, stand in meters apart from each other when getting meals. Best be one table per person. Do not eat when you are face to face with someone else. When students having meals in the cafeteria, they should wash their hands before and after eating, and the staff responsible for food distribution should wear masks and disposable gloves at all times. Try not to communicate with people much and keep a safe distance. Cafeteria staff should have their clothes washed and disinfected every day. Also, we must pay attention to the disinfection and storage of tableware. Disinfect tableware before students return to school. Disinfection should also be performed after each meal. You can put the tableware in hot water and sterilize it for at least 15 minutes. You can also steam the tableware for 15 to 30 minutes for sterilization, or use a disinfection cabinet for 15 minutes under 100 degrees Celsius. For food, pay attention to the combination of meat and vegetables. Prepare fresh fruits and vegetables, balanced nutrition, ensure enough protein. We encourage teachers and students to drink plenty of water to promote body metabolism. All food should be thoroughly cooked and consumed as soon as possible. Cooked food can be stored at room temperature for no more than 2 hours. As school reopens, we will need to do a lot of work to ensure health and safety for all members. Careful work is required to help all teachers, students, and parents to work and study on campus with confidence. Thank you for watching.